Doctor, what are we looking at now?
Okay, now this is the MRI of his lumbar spine. Basically, it's the same premise, except that in this case, on this view of the MRI, it's showing also if you see this white structure, this is what's known as the thecal sac. This is a sac that holds the spinal cord, and then when it gets down, the spinal cord has already ended, but this is where the sac holds the spinal nerves. This is the L4-5 level, and this is the 4-5 disc. This shows a bulging disc here, which is in contact with the thecal sac at L4-5. Whereas if you look at 5-1 below, that's a normal disc showing that there's no bulging or compression, or looking at the next level of L3-4, same thing. So the sagittal view is a view if you're looking at somebody, if you put them in a salami slicer and cut them in half, and you're looking at them on end, that's what this view would be.
Now, what are the consequences of having a disc bulge that impinges upon the thecal sac?
Well, there's neurosensitive structures all around there on the outer annulus, this portion here, and also around the thecal sac, so it certainly can create pain. And
now, is this the type of condition that you regularly treat in your practice?
Yes.
And what are the various modes or ways in which this can be treated?
Well, typically you start with a therapy program, exercise, back schooling where we teach them how to bend and lift properly, avoidance of the certain activities that can make things worse for them. If that fails, then we move on to before that, we also use medication, anti-inflammatory medicine, muscle relaxers. After that, if they're still painful, then we would try a cortisone shot, depending on where we believe the source of pain is, which we could do an epidural injection, or also...
Would you like a different color to show something else?
Actually, can we go back to that other diagram? Part of Mr. Burmese' condition was that I felt that he had a problem with his facet joints of his low back as well. And the facet joints are responsible for the spine to bend forward and backward. And they're little, what we term synovial joints, which means that they're a true joint, and they have a fluid and joint capsule. This is the facet joints here on each side that we would be concerned about, and that's where he was having a lot of his discomfort as well. And these become inflamed, especially after an impact and they've had an injury to their low back. These joints can become, the ligaments around it can become torn, and then the joint becomes inflamed, and then it can become a painful chronic condition known as lumbar facet syndrome.
Objection.
Go off video, please.
Going off the video record at 11:23 a.m. We're back on the video record at 11:23 a.m.
Bill, can I ask you please to take that exhibit down for a moment? And then if you would just give me access to the